everyone. My name is Jason DeZerka. I'm the Director of Supplemental Health Solutions here at Cigna Healthcare. And today we'll be talking about specialty solutions. That includes dental, vision, and supplemental health products. And when these products are combined with a medical plan, these solutions can really further support whole person health and lead to a smoother, more consolidated benefits experience for both employers and employees. Today, I am joined by Julie Kozak, National Director for Dental and Vision, and Scarlett Rodriguez, Growth Leader for our Supplemental Health Solutions at Cigna Healthcare. Hi, Julie. Hi, Scarlett. Our health is more connected than we may realize, and what many used to call voluntary benefits are now essential. So with that, let's dive into a few of these items. Julie?
Hey, Jason. I am so thrilled to be talking about Cigna Dental Solutions and our way of looking at overall health that's very different in the industry. You said it. Overall health is connected from oral health to mental health to physical well-being, and all of those things impact the clients that we serve, health and vitality of their employees. We have a program that we call Cigna Dental Health Connect that is really our clinical and advocacy model that wraps individuals in care regardless of what stage they're at in their oral health care journey. Let's definitely start with how we're addressing the needs of those that have the most chronic medical conditions that we know have adverse oral health impacts, but also have adverse medical impacts if their dental health is not maintained. So let's think about one of the things we hear a lot these days in the news: cardio-diabetes, cardiac conditions, diabetic conditions, and all three of those conditions are linked to gum disease. And that's where our oral health integration program comes into play. Individuals that have one of these three conditions are at greater risk for periodontal disease. And periodontal disease, simply put, is an infection underneath the gum line that really impacts our overall health. And as an example, once periodontal disease is present for a diabetic, they have a greater chance of ending up in the ER because they're not able to manage their blood sugar levels. We know through our integrated studies, when we have clients that have both medical and dental with us, that on average, we can save in some of those chronic conditions over 10% on their medical plan costs, which is really, really profound. In addition to that, we also have outreach programs, meaning reminders for individuals if they haven't been to the dentist, recare reminders, again, making it simple to kind of nudge them into the care that they need. We don't stop there. We know with vision, it's so important to have your vision needs met. As an example, children, the number one undiagnosed vision condition is their ability not to be able to see, which affects their performance in school. So the importance of truly understanding negative vision impacts is profoundly important from a productivity perspective. But when we think about even further those individuals that have serious health issues, and again, I'll bring up that individual that may have diabetes. We know that diabetes can lead to potential blindness if your eyes are checked and if your diabetes is left untreated. So the importance of that eye exam with that diabetic patient is also incredibly important. So when we look at all of the ways that communicate with our customers, we want to make sure that they're aware of all those connection points. The other area that we see as a challenge, and our customers have seen this, is that they'll have a dental benefit, they'll look at their utilization, and they will see that a subset of their employees never use it. We have come up with the most brilliant solution for that, and that is part of our supplemental suite of products. So we know that most dental plans and vision plans, it's 100% coverage for preventative care. And yet we know a third of individuals still may not utilize their benefit. With our supplemental benefits, and I am not going to steal Scarlett's thunder, we have a solution for that. So hopefully, Jason, that gave you a little bit of a flavor of how Cigna Dental is different.
Thanks, Julie. Another big component of our overall well-being is obviously our mental health. And supplemental health benefits like accidental injury, critical illness, and hospital care coverage can really play a big role in boosting mental health. So Scarlett, can you tell us a little bit about this?
Well, thank you, Jason. Like Julie, I'm so thrilled to be here today and be able to speak to our supplemental health solutions and how it can really help mitigate a wide variety of stressors our customers experience every day around their overall health and well-being. We know that people often face stress and uncertainty when experiencing an unexpected illness or injury. And a lot of times, this unexpected event can affect every aspect of a person's well-being. Physical, obviously, right? But also mental health and financial impacts. And as a healthcare company, we know that a healthy workforce is vital to a healthy business. And supplemental health insurance can help minimize employee financial burden and mental strain from these significant health events. In fact, we sponsored a study that revealed that 72% of employees said supplemental health plans make these unexpected health events more affordable. And an astonishing 75% of employees said supplemental health plans provide peace of mind during unexpected health events. So again, having these products tie back to helping mitigate that mental and financial stressor. We also know that besides all of our efforts, right, even with medical coverage, employees may still have out-of-pocket expenses. And because supplemental health insurance is designed to pay cash benefits for covered injuries, illnesses, hospitalizations, and are paid directly to employees, they use it however they see fit. And these funds can help cover things like household expenses, childcare, things that aren't traditionally covered by HSAs or HRA plans, in addition to traditional copays and deductibles. Aside from peace of mind and mental health stressors, another way supplemental health solutions can support whole person health is by offering the right types of coverages for today's workforce. As a medical carrier, we have a lot of data that we can leverage to help design better plan options that are more relevant to a working, active employee population, and therefore covering a wider range of conditions. One example is how we continue to innovate and bring more value to our critical illness plan. Our critical illness plan traditionally has catastrophic conditions like cancer, heart attack, and stroke. But we know that today's workforce faces other health conditions that are diagnosed very frequently and in younger demographics. Two good examples of those are Crohn's disease and advanced obesity. So here at Cigna, we're innovating and furthering our product menu in response to real challenges supported by medical data trends, allowing us to be more consultative in market, which is really unique. And we can't ignore one of the most discussed topics nowadays, which is behavioral health. Did you know that behavioral health accounts for 7% of all hospitalizations? And 1 in 5 employees are diagnosed with a behavioral health condition. It's pretty impactful. With this in mind, we were able to add benefits to our critical illness plan that helps provide peace of mind to those employees that have the highest financial exposure, which is behavioral health coupled with hospitalization. So again, a consultative approach on product innovation based on needs, data, and value.
As we know, it's critical to offer these benefits that will be useful and provide value to employees. So what are some other ways employees on our medical plan can benefit from having these other products with Cigna Healthcare?
Sure, I'm glad you asked. And this is that teaser Julie was talking about earlier. One of the most important benefits between a bundled medical and supplemental health offering is the ability to have real-time claims integration, or what we call Cigna Simple File. And what that means is it simply allows us to help our customers maximize their benefits by conveniently sending reminders when a medical claim could also be a supplemental health claim. Our goal in doing that is to help employees remember that they have this coverage and use it, right? So taking Simple File one step further, we've enabled wellness autopay. Most of our plans have a built-in wellness benefit that encourages employees to go get their preventive care exams and screenings, which of course boost overall health. We are now automatically paying this benefit without the need for the customer to file a claim. So it is helping further the value of the supplemental health plan beyond having an unexpected illness or injury. It's helping promote preventative care. And a fun fact about that wellness is it also includes routine dental screenings and routine vision screenings as part of that wellness menu. So really making it a well-rounded health benefits package and bringing back that integration to a whole health solution with medical, dental, vision, and obviously your catastrophic conditions with critical illness, accidental injury, and hospitalization.
Thanks, Scarlett. So, Julie, anything else you'd like to add on how these products can be more connected through Cigna Healthcare?
Yeah, I think the big differentiator is that engagement experience that is simplified and all in one space for that end user, our customers, our clients, employees, and that's the MyCigna experience. It is, and specific to the dental, our cost and transparency tools are best in class because a member can search for a dentist based on what's important to them. They can read verified patient claim reviews from actual Cigna Dental members. They can look at the affordability score of that provider based on their plan, meaning knowing down to the exact dollar how much procedures will cost them, how much is left in their calendar year maximum, in addition to looking at a provider's professional history score, where they went to school, what special certifications do they have in their practice. So again, really making it a consumer experience based on what's important to them. Whether maybe they're looking for a dentist in their area that's open on weekends, they can get that through the MyCigna experience when they look up providers.
Yeah, and Julie, I'll add to that in terms of the MyCigna experience from the supplemental health angle. Ease of use, right, is such a big talking point in the industry when it comes to supplemental health benefits. It really couldn't get any easier than to use MyCigna to help manage the claims process in terms of the ease of use of submitting claims with supplemental health. So with MyCigna registration, you see the supplemental health menu of what you're enrolled in. You're able to pull information from your facilities that you visited, from doctors that you saw, to be able to pre-fill claims information right on the tool. You're able to track the status of your claim and enroll in direct deposit to be able to receive that cash benefit directly, easily, and quicker. Couldn't say more things about the investment that we've made on MyCigna and making sure that this is a very connected and integrated tool for our customers with an integrated solution.
You really see the overall Cigna Healthcare connected experience with our specialty solution products. And it's critical for employers and employees to be offered these type of benefits, whether it's supplemental health, dental, vision. Julie and Scarlett, thanks again for joining us today. And to our listeners, thank you so much for tuning in and being valued partners of Cigna Healthcare. We look forward to sharing more information like this with you in the future. Thanks again.